Thank you for the invitation to join you today to discuss my new book, Neglected No More, an elder care and the caring economy more broadly. Recently, I participated in a call-in show. The question was a profound one. They asked the public, where do you want to live out your final days? You'll not be surprised to learn that the vast majority of callers said they never wanted to go into long-term care homes. Some said they would rather die than go to these facilities. Most said they want to age at home in the community. There are three words that came up time and time again in this discussion when people were expressing their wishes: autonomy, respect, and dignity. That, in a nutshell, describes what care should be, what a caring economy should be, if you want to put it that way. That's the key elements: autonomy, respect, dignity in all our social policies. That's not what people get in our social welfare system today. It's not what they get in institutional care, especially during COVID-19. There have been almost 24,000 pandemic deaths in Canada, and about 17,000 of those occurred in long-term care homes and retirement homes in congregate settings. Then there was the collateral damage, the isolation, loneliness, deconditioning, and decline that occurred because family caregivers were locked out. People were isolated. The impact was also devastating, albeit more difficult to calculate. We know how many died of COVID. We don't know how many will die of this isolation and loneliness. And of course, no one wants to lose their autonomy and be dispatched to an institution. So this sector is never going to win a popularity contest. It's certainly not Disney World. Now, the book I've written is not about COVID, except peripherally, nor is it a condemnation of the sector or of social policy broadly. It's about larger themes I've been writing about for many decades now. How do we ensure that every Canadian gets the right care at the right place at the right time? How do we structure our health and social welfare system so that everyone can live to their full potential? And how do we, in all our healthcare interactions, prioritize quality of life? Now, I believe that when it comes to elders, especially frail elders, we fail on all those counts. The generation that gave us our beloved Medicare system and our somewhat less loved social welfare system has been forsaken by them. Now, this isn't news. There have been at least 150 government-sponsored reports written about the shortcomings of Medicare and about social welfare more broadly, and they all talk extensively about elder care. All these reports have essentially the same conclusion, that the neglect of elders, the neglect of marginalized people is a systemic issue. So let's fix the system. Let's think differently. That's essentially the blunt message I try to deliver in my book. Stop talking incessantly about these things, stop pointing fingers, stop passing the buck, and just fix them. Now, assuming the horrors we witnessed during the pandemic finally give us the impetus and the backbone to do so, where do we start? I think we have to start with a fundamental change of attitude by adopting a philosophy that says we value our elders and we want them to remain active members of our communities. Once you have that goal, once you have that philosophy, once you make an explicit choice that you want a caring approach to elders and to the economy more broadly, everything else is really just technical implementation. That's true whether you are talking about homelessness, childcare, inclusion of people with disabilities, or elder care. Now, in the recent federal budget, there is a promise of $10 a day childcare and a $30 billion commitment to that idea. I have nothing but praise for that initiative. It's good for child health, and it's good for women, and it's good for society more generally, for the economy. It's putting caring in giving it life. But I think we should have made an equal commitment to the other end of the age spectrum, for elder care. Just as many women care for their aging parents and grandparents as they do for their children. And while the cost of daycare can be crushing, the cost of long-term care or home care to keep a loved one at home is often far more. It can cost up to $15,000 a month to have someone in long-term care facility. To me, the federal government has, at best, done half the job when it comes to having a feminist agenda. There are almost 400,000 elders living in institutional settings in this country, one of the highest rates in the world. This kind of elder apartheid is unacceptable. The default setting should not be that you go off to an institution when your health begins to decline. The default setting should be you stay in your home as long as possible, and you only go to an institution as a last resort, when you need 24/7 care and you have to be watched around the clock. Practically, that means shifting our spending from long-term care to home care. It means investing in affordable housing for elders, in community supports, everything from public transit to meals on wheels. I'm not suggesting that we don't need care homes or congregate settings. Of course we do, especially for people with advanced dementia. But as I said, they should be a last resort, and they should be built purposefully. As you know, the majority of residents of long-term care homes are living with dementia, but very few facilities are designed specifically for their needs. For example, with safe spaces to wander, indoors and outdoors. Homes should also be, well, like homes, home-like. 200 and 300 bed biomass don't cut it, even if they're organized into pods of a few dozen. Care homes should also be integrated into the community and ideally paired with other facilities like daycares and schools. Elders should not be invisible in our daily lives, and we should stop pretending that old people only want to spend time with other old people. They don't. The question I get asked most often is, there's so much to fix, where do we start? Well, as I said, I think it starts fundamentally with a change of philosophy. And then we start where the biggest problem exists, and that's staffing. Healthcare is a people business, so is social welfare. We need a sufficient number of people to provide the care that we need. That's what a caring economy is. There's a lot of clamoring for standards of care. For example, guaranteeing 4 hours of hands-on care daily, staffing ratios like 20% RNs, 25% RPNs, 55% PSWs. Now, I wish those things weren't necessary, but I think they probably are, at least in the short term. But standards are not useful unless we fund them. You can't mandate 4 hours of care and pay only for 3. It doesn't work. I mentioned infrastructure briefly, and it's important too. We can start by getting rid of wardrooms with 3 or 4 room beds, but larger changes will take time. Now, money is always a question. Do we need more? Absolutely. After years of neglect, there's some serious catching up to be done, and not just in this sector. But we already spend a lot of money on long-term care and home care. We just don't spend it well. We don't get value for money. Now, the final thing I'll say is something that's self-evident to this group. The voice of individuals is essential to building a care economy, not just as a starting point for reforming healthcare generally and elder care specifically. You have to have that patient voice, that family voice, that recipient of care voice. During the pandemic, patient-centered care has taken it on the neck. We have to get the patient and the consumer voice back into the mix, and quickly, not just the corporate voice. People need choice, real choice, in where they live out their final years, how they're cared for. They don't just need care, they need quality care, dignified care. And again, this applies across the board. Once you put the emphasis on quality, everything else seems to work itself out. Finally, a couple of words about innovation. As you can tell from my brief comments, my book is a sometimes harsh condemnation of the care we provide to elders. But I think ultimately it's a hopeful tale, because I stress that not only do we know all the problems that need to be fixed, but we know all the solutions. Elder care, like healthcare more broadly, like social services, is provided on a spectrum. Yes, there are some terrible homes, but there are a lot of good ones too. And I should note, there's way too many mediocre ones. Every problem we have in society, every problem we have in social policy has been resolved. It's been resolved over and over again in pilot projects. We have to scale up our successes. We also have to give life to our values. We can't just settle anymore. We have good values. We have sound values. Let's give them life. Thank you again for the invitation.